Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and I'm here with Todd Hamilton. Todd, please introduce yourself.
Hi, everyone. My name is Todd Hamilton. I'm the current second year administrative fellow at Norton Medical Group at Norton Healthcare.
Thank you so much for joining us this evening, rather. I appreciate you coming on. You have a vast amount of experience. You went through an administrative residency. You, of course, have your MHA and your bachelor's in care, health, and society. Please share with us what you started off as, what your plans were when you went into undergrad, and why you chose to go to the University of Arkansas, and what that looked like.
Yeah, absolutely. So I am originally from New Orleans, Louisiana, and I always wanted to go to an out-of-state school. I was looking for a school that had unique opportunity, and always really wanted to be in healthcare. Had that passion for healthcare. Had well, at least for the helping professions, and then upon going to the University of Arizona for my undergraduate, looked at a variety of different majors and actually started off as a biology major. I really wanted to be a physician, practice medicine of some kind, and always had a real interest in orthopedics and the orthopedic service. And so really looked at that as a future career. But as I went on in the switch majors into care, health, and society, I realized that there was so much more to healthcare and the breadth of what's going on in terms of the human relations side, the actual medicine delivery side, and then also the whole piece of the government's role, the role of healthcare systems, and really just the idiosyncrasies that go on within the healthcare sector. So the care, health, and society major I ended up going into, and it's housed within the College of um, Behavioral Sciences, and it really had an emphasis on healthcare sociology and philosophy. So took a lot of classes that were taught by nursing leaders, by people who are thought leaders in the philosophy world, people who work in the public health sector, and so was able to get really around a real roundhouse view of what healthcare was and what it means to be in the helping professions. And I think back to so many of my professors who were able to kind of shape who I am as a leader now from that experience. And then you're right, yeah, I went on to the University of Arkansas for medical sciences, where I was able to get my MHA and got involved with a lot of different programs early on. It was a little bit of a smaller program, which is, that was the intention, to really get involved as much as possible and really to, connect with my professors, but also connect with my classmates, and was able to really look at the opportunities that were around me. So able to do a residency there and then went forward. So yeah, thanks for having me today. And that's just a little bit about my background as, talking about education at least.
Of course. And then during your MHA, you did a residency. And was that a required part, or is that something that was optional?
Yeah, it is definitely a required part of the program. It is really extends from the beginning of your second year, I would say. So that summer after your first year, you dive in as a full time employee with array of systems. So I was able and lucky enough to work with the Arkansas Rural Health Partnership, which is a consortium of critical access and regional hospitals in the Delta rural region of Arkansas, and it was very unique experience. It was in the height of COVID. When you think of these communities, they're very small, rural communities, but also ones that are very close knit. So being able to work with all 16 of those hospitals across 22 counties in Arkansas and seeing the great work that they do, both with the government, the national government, the state government, but also those rural communities and those communities, those close knit communities themselves was truly beneficial. And getting to see the different parts of how care management and working to get patients to the places that they need to go in a timely fashion, but also back home close to their loved ones. It provided a very, very unique experience for me, at least.
Absolutely. It seems like a very valuable experience. I know that I like the programs when they include that residency portion. I think that's always a good idea. But with that though, one of the questions I ask when people have they've gone through the residency as well as you've done a few other things as well before your fellowship. Why did you decide to apply for the fellowship given the experience you already had? And with that in mind, has the fellowship been a big educational kind of level up from your past experiences?
Oh, absolutely. And the reason why I really want to do a fellowship is, you go into, a graduate program and you think you come out, you learn all the, I would say, intangibles. And those intangibles, you talk about finance, organizational leadership, human resources, all of those great things, and health policy, whatever it might be. And you learn like the what is it, right? What is it about? How does it relate to healthcare? Those kind of things. And then really what the fellowship is putting those intangibles into practice and really refining your skills. Organizational leadership. Well, there's a whole piece to organizational leadership, from the actual structure, but also how do you interact with people? How do you have an executive presence, but also how do you show people that you're also a human being and relate to them on an individual level? Whether it's your peers, as in if you have an additional fellow that is with you in your organization, how you do that with your boss, or even when you're rounding in clinics or hospitals, those frontline workers, and really connecting with them. And you may be part of administration, and some people have a negative connotation to that. I'm fortunate that that really does not happen here, and that's intentional, right? So really wanting to go into the fellowship piece of learning how to do all of those additional things that you really don't get in your program, as well as the executive exposure, right? To really refine those skills in front of leaders who are ultimately going to hire you, are really going to have their interests, or your interests aligned with theirs, and really bring you along in your career, really grow you into the leader that, one, you want to be, but also one that is going to be successful within the organization that you're joining. So that's really why I wanted to do a fellowship. I really wanted to get that advancement into my career, and I looked at it as more of an investment into what I wanted to do after my MHA. Figuring out whether it's a specialty, whether it was going into executive practice of some kind within a medical group, and how to work with physicians, how to work with nursing leadership, all in one bucket. I think this experience has definitely expanded my knowledge and education, and really put me in a new place that, had it been 2 years ago, I don't think I would have been in.
So well worth the value then of those 2 years.
Absolutely, absolutely, and well worth it.
That's really good to hear. And then, so why did you go with Norton specifically, and how many other fellowships did you apply to?
So when I was applying, I applied to about 12 other fellowship programs. Really wanted to, the advice that I got from so many people who did fellowships was, really look at, cast your net wide, but not too wide, right? You don't want to blanket apply for all of these places, because you may end up getting a offer from a place that you really don't want to be, and it really may limit you, or really put the time into your application. And that's what I took from that is, yeah, there was a few places I really wanted to be, and then there was a few places that I knew I wanted to get a fellowship, and I applied there, and maybe I didn't really want to be there. So I did that a little bit, but didn't really try to as much. I really tried with the places that I wanted to be, and I knew I really wanted to be those, six programs, those six places. Norton Healthcare was one of those. At that time, Norton Healthcare, you could hear little fringes of things, and I was talking with my professors about just some of the opportunities that I was looking at, and you go down the list, and my human resources professor at the time, and was the CHRO at UAMS, and she's now doing some other things in consulting. But she stopped me, and she pointed right at Norton Healthcare and said, "That's a phenomenal company." So as I go through and did more research, you see the Leapfrog A+ scores, you see the best places to work in Forbes, all of the things at that time. We're going to build the first hospital west side of Louisville in 150 years. And you just look at that company, you say, okay, that's an innovative company. That's one that's growing. That's one that I want to be a part of, because they invest in their people, they're investing in the community, and they're investing in really the advancement of the community and their people and the organization.
So you gave yourself, a good amount of options with the 12, but you still were pretty targeted about it. You didn't apply to like random programs. You did a lot of research, and you said like a few of your resources were like Forbes. You also looked in like the news articles to try to find out what the different institutions was doing. And then you also consulted with your faculty, right? Those were kind of the three resources you used.
Yeah, and I would also say use your alumni network. The alumni network is huge when you're looking at organizations and definitely talking about their experiences. So I talked to a few of the alumni that went on and did fellowships in the organizations that they're at, and obviously I applied to a couple of those places because they had nothing but great things to say about them. And they seeing where they are now in their career and continue to see where they are now in their career, it had to have had a profound impact on them and their career. So obviously want to apply to those places, but really leveraging the alumni network and people who have been in your position, been in your shoes, know what you're thinking with regard to where you want to be, 5, 10 years after a fellowship.
Definitely. And then so you get into the fellowship, one of the ones you said that was one of your top, few choices there. And then when you get in, what was that first year like?
Yeah. So Norton Healthcare is a not-for-profit community-based system. We're heavy emphasis on innovation, research, but also really into what the health of our community. We're the second largest employer in Louisville, and we're rapidly expanding to provide healthcare across the organization. Well, obviously across the organization, but across the communities we serve. So our first year is predicated on rotations, and you have project work that things that come up that may go from rotation to rotation as you work with service line vice presidents, as you work with other leaders, directors, managers across the service lines. But also the rotations give you a really good opportunity to see the systemness and going to the hospitals, going and working with managed care, going to work with the nursing coordination teams or the care coordination teams, going to work with nursing admin, going to work with, materials management and supply chain, and getting to see the entire breadth of the organization and all of the great things that the organization does, all of the great things that we're able to do together. So that, IHE, our Institute for Health Equity, looking at, getting to spend some time with them and, hearing what we're doing for the underserved communities, working hand in hand with some of our managed care folks who are looking at not just our contracts and capture rates and other things, but also working with those patients who are economically disadvantaged on what we just announced was an expanded financial assistance program.
Mm.
Because we are a not-for-profit organization, that we are able to do that. We wholeheartedly believe in accessibility to care for everyone. So being able to see all those things firsthand, in the cancer institutes and everything, it's been phenomenal. And you really take that and really leverage that into your second year as you elevate. So again, I was involved with projects, but the rotations, I cannot recommend more for a system like Norton, but also for your fellowship program.
I think that's a good way of doing things. And then can you tell me a bit about that elevation you're talking about in that second year? I know you and me talked a little bit before we started recording about what that second year looks like. And I think this is one of the unique fellowships that does this in the second year. Can you kind of explain what that looks like and also what the transition was like, how hard it was or anything like that?
Absolutely. Yeah. So in our second year, our boss or our preceptor, if you will, he's a vice president of operations for the medical group for the division. And he's very intentional about challenging us. He'll tell you in our first year, this like, okay, we're going to push you to a limit, and then we'll see how comfortable you are. And that when I say a limit, it's like time allocation, like how much more time do you spend with rotations, and then are you balancing the project work that you are given. So in the second year, really taking that with intentionality of knowing really where you want to be, because if you've had those experiences, but also you got a little taste for the project work and the actual operations that are going on, you're able to align yourself with a leader that is a service line leader who wants to take you on in an interim capacity, whether it's the organization's need. We may have a couple practice manager positions open, and it may be a benefit for you to go and get that interim practice manager operations role under your belt, and really work in the weeds with your physicians, with your practice employees, with the service line itself, and really leverage that experience into what could be a job at the end of your fellowship. Some other things are, you work well with a certain leader and you want to continue work with them. And so there may be some projects that you work on with them that actually does turn into a position. And so you really don't know what's going to happen your second year until you're there, because there's just so much that changes. And as we know in healthcare, a lot changes. But working with those leaders and figuring that out, because your interests, they do take into mind. So I've always had an interest in orthopedics, and that's where I've taken on an interim manager role within the orthopedic service line. But before that, I was actually with Women's Health Services for 5.5 months, and never thought I'd be with Women's Health Services. I actually work really well, and I am so thankful to this service line leader, the service line vice president at Norton Healthcare, for Women's Health Services, for taking me under her wing and really showing me all of the different things that go on with women's services, but also some of the unique operational challenges, right? In physician operations, you have an OBGYN who will see patients in clinic, who will do gyne surgeries, and then also is on call at least once a week probably for delivering babies. And so the operational challenges that presents in terms of seeing patients in all three of those phases of operations is truly unique. And then some of the more high complex things with maternal and fetal medicine and some of the different things that we're doing there. So that whole experience for 5.5 months was truly something that was an organizational need and connection that I had with a service line leader that I was able to leverage for 5 months, and really got, profound experience out of. And then it was able to transition to orthopedics, where there was a need for a little bit, and also area of interest of mine. I was able to work with our service line leaders here, and worked in a few different of the practices, turned around a couple of things operationally, and getting to see what that's like. And then hopefully we'll transition into a job very soon.
Exciting. So, is that job going to be within the orthopedics sports medicine service line?
We'll see. We'll see. I've interviewed in a couple different places within the organization with regard to staying in the medical group, but it's a couple different positions that are open, and seeing what options are available. But I truly hope so. It's a great service line. I love the leaders within those service lines, the practice managers and the director and service line VP. They really take an interest in you as an emerging leader and as a fellow, and truly, I would say, contributing to your growth in every way. So,
It's really
giving you
good.
whether those operational projects, the strategic initiatives, or whether it's just giving you the sheer practice, the latitude to make decisions within your practice, and the autonomy to make decisions in your practice to achieve what I would call operational excellence. Hitting those major factors: the patient experience, your employees, retention, obviously hitting your volume goals and things like that, but also, just making it and empowering your people to do great things. So I think the experience that I've gotten has all encompassed that.
Can you give some advice to others earlier on in the process on what you've done that's been able to lead to such success?
Absolutely. Yeah. I would say for those students who are thinking about MHAs, who are thinking about fellowship, who are thinking about, or even in their fellowship now, or getting ready to enter in your fellowships, listen. But listen, not to just listen to change. There are there are words and things that are said to you that you may not understand. And when I say understand, obviously you comprehend what they're saying, but you don't understand the true meaning behind it. And so there's a lot of just subtle hints that people will give you around, hey, maybe, and it may not be so obvious as literally this, but hey, maybe don't approach it in this way. Let's approach it in another way. And here's why. And you won't really get to learn those things until it kind of comes full circle, and you see maybe the action that I took, or the thing that I said, or the decision that I made was not necessarily the best one. It worked out maybe in that time, but it wasn't the best one that really kind of leads you into inspiring people and really galvanizing people to get on board with that decision or the things that we're trying to achieve. There's many different ways to get to the place you're going, and it's really about how do you do that in the most graceful manner that really works well for, and you can't please everyone, so I'll say that you can't please everyone, but you will, try to inspire people on the way. The second piece of advice that I would give is don't be afraid to put yourself out there. Most of the organizations that you'll be going into and working with are accustomed to having a fellow. I know when I joined Norton, a lot of the organizational leaders knew that we had a fellowship program and knew about the fellows, but didn't really know you until you've met them. So don't be afraid to put yourself out there. We just hired a CAO who joined us from another organization to be the CAO of our children's hospital. And I was, you get to go to a lot of these high level meetings and be a participant and sit there and listen and absorb all of that great information. And so after, there's a lot of, handshaking and people, saying hi to each other. And so obviously going out of your way to make those connections with those leaders, because you never know, that may be the leader that ends up giving you a job at the end of your fellowship, or maybe the one in 5 years to promote you into their organization or into their division, I would say, of the organization that you're with. So, really leverage that ability in your fellowship to make that network and really establish that network. Build your personal board of directors. And this is advice that I got, but really find those people who are interested in you, invested in you, and are those people who are going to be your sounding board. Because you're going to find yourself, whether it's in a tough situation, you're going to find yourself in conflict, you're going to find yourself in a situation that is really unfamiliar, and you're really going to want to find those people who are going to steer you in the right direction. Those people that you can really lean on to gather resources or advice or whatever it might be. And that happens in so many different ways, right? That happens in beyond so many different ways. I can't even tell you how many different people that now that I think and I consider on my board of directors, how that relationship developed. But really try to go out of your way and really look for those people who are interested in you, because those are the people who are going to help guide you through your fellowship program. And obviously, your second year fellow, if you're a first year, and if it's a 24-month program, or someone who is immediately right outside of the fellowship, those are probably going to be your immediate first contacts. But really leverage their network as well, because those people who are sticking around them are probably going to be the people who are going to stick around you as well. So don't be afraid to do that, but also that I think that's really key to being successful in your fellowship program.
And I couldn't agree more. And I haven't even been through, the fellowship yet, but just from my small experiences, taking the advice of individuals like yourself, it's just connections, and then listening to those connections and getting those mentors and champions has already, improved, my work life so much. So excellent advice, Todd. And thank you so much for joining us and sharing from your wisdom and your experiences with our audience. I really appreciate it.
Absolutely, I'm happy to do it, and very, very gracious for you having me on today.